So, Dr. Frawley, when I'm choosing a bone graft material, I see all kinds of different configurations on different websites and catalogs. I see mineralized, demineralized, cortical, cancellous, 60-40, 70-30, 50-50, all kinds of configurations. What's the deal?
Yeah, there's all kinds of materials. I think the overall guiding question is what material is going to give you the highest vital bone content. Because the more vital bone you have, the more greater chances of great healing around your implant, greater chances of full healing in the socket or the defect, and long term, that vital bone will help to support your implant. So, let's look at it from that point of view. So, when we think about the different particles, we're talking about the different amount of minerals in the particles. So, if you start out with cortical particles, they're from the outside part of the bone, and they're just solid, dense particles with no trabecular form at all. Cancellous particles are from the inner part of the bone, and they've got porosity to them. And the porosity is very useful when it comes to absorbing bone and creating a stable clot. Demineralized particles are very porous because all of the minerals are removed. So you're going to get potentially a little slower healing without any particles, and you're going to potentially not be able to maintain the space as well as something that's slowly resorbing. The demineralized will resorb quicker. Nobody's shown that there is a clinical difference. So the benefit of the mix is that with the cortical particles, you'll get a more stable clot and less chance that you're going to get some shrinkage. The straight mineralized will heal faster because it'll turn over faster and create the patient's own bone and vital bone. But the cortical particles will help kind of hold the space. If you have a single socket with no defects, 4 walls all intact, ideally what I would use is a straight mineralized cancellous because it will create a nice stable clot. It'll absorb blood. It'll turn over quickly. And in those situations, certainly right at 3 months, I'd go back and place the implant. You can also use cortico-cancellous in that area. I might give it a little bit more time healing if you're using a cortico-cancellous, but it certainly is appropriate as well. If you've got some defects on the buccal wall and you're concerned about really kind of building out that buccal wall, that's a place where I would use the cortico-cancellous because those cortical particles, again, will resorb slower and help to hold that space well. If you have multiple sockets against each other, so the potential for the interproximal bone to resorb is greater than if you're grafting against a tooth. If a tooth is there in the adjacent space, the height of the interproximal bone will generally be very stable. So if you're doing 2 extractions next to each other, the interproximal bone height is not as stable. And so that's a place where I would use the cortico-cancellous as well to help to maintain that bone height as much as possible. In a sinus, you can pretty much use either mineralized cancellous or cortico-cancellous. Both have been shown to work equally well. And again, the important part is using a material where you get a really high vital bone content because that's where you want good bone vitality to, again, heal around your implant. So that kind of goes back to talking about particle size. So part of the amount of vital bone content you get will depend on your particle size. So your typical mineralized cancellous is most products are going to be at 0.25 to 1.0 millimeter particle size. But the important part of that, which nobody really talks about, is what is the amount of particles from 0.25 to 0.5 and from 0.5 to 1.0. So the surgical aesthetics material, we're heavily weighted towards the 0.5 to 1.0 because it has been shown that the more powdery the material, the less vital bone that you're going to get. Again, that makes sense because if it's very powdery, like sand without any porosity to it, it's not really going to absorb blood well and not create a stable clot. So the ability to absorb blood and the porosity is really important. So you have to be real careful, especially with some of the lower cost materials are very powdery. Again, I don't like the materials that are like a 0.25 or a 0.3 to 0.75 or to a 0.8, because then you're going to have much smaller particles and you definitely do not get as good a healing. The other option on particle size is a 1 to 2 millimeter. And the 1 to 2 millimeter is definitely a larger particle size, and that would be good if you're doing a large lateral graft, where you're building up a large area, or sometimes if you're doing an open sinus, not an internal sinus, and you're really gonna pack that well, then there's a good use for the larger material, the 1 to 2 millimeters. Around implants, if you're placing an implant and you've got some defects around that implant that you're packing, again, you want to use a mineralized material, and the smaller particle mineralized cancellous, which is a 0.65 to 1.25, is a good choice there. Let's say in an area where you've got a defect and you're going to do a bridge. Tooth came out, you're going to do a bridge there. Again, you don't want that area to become a big convexity where the pontic has got to drop into that space. So that's an area where I potentially would use a complete cortical material. And the cortical, again, is dense particles that will resorb very slowly. And that's perfect for a pontic space, because you want that space to really resorb slowly. It would resorb too slowly, in my opinion, for placing an implant there. But for a pontic space, that would be an ideal material. And when you're talking about all on X kind of materials, all on 4, all on 6, all on 8, again, a lot of times you are removing, some bone, but there's still going to be some defects, and you don't really want a roller coaster kind of anatomy. So where there are defects, it's good to fill that in, and a cortico-cancellous is a good material for that.